You want me to film this way or this way?
I've already done it though, that way to stay there. Hi everyone, we're both in there, should I change it? I can change it. Is that good?
Yeah, is it filming? Yeah.
Okay. So we're here today at Liverpool Pig Save, and I'm here with a really beautiful vet who's come to show. What's your name? Amrit. Yeah. So we're here outside of Pig Slaughterhouse, and we're talking about the differences in farming practices and the way we treat our pets. So, like here in England, it's standard practice to. So you tell me when you do castration on a cat or a dog, what do you do?
So first of all, you have to get paperwork signed by the owner to give consent for the operation to take place.
Can we hear this?
You hear that?
Yeah, stand close.
So first thing we need is consent from the owner. You can't just start castrating animals. You need to have the consent of the owner of the animal for us to do the procedure. They come in, we give them a cuddle, they sit in the kennel, we decide based on their temperament and their personality what's the best drugs to give them to make them sleepy. So we tailor their medicines to them, we anaesthetize them, we perform the procedure. There's adequate pain relief, they're recovered in a safe environment. There's nurses in the kennels as they get recovered, and they get fed afterwards. And
when you say adequate pain killers, so what painkillers are these? What you normally give?
It depends on the practice that you work at. We have the same anaesthetic drugs that we'd have access to if we were to go under the knife for a procedure. To have a lump taken out, or whatever.
Yeah. It's like local anaesthetic.
It depends on the practice. Often we go with kind of opioids, so like derivatives of morphine. Sometimes we give ketamine. We have non-steroidals. There's a number of drugs, and we tailor it to the individual, their age and their temperament. If they're bouncy, if they're chilled out, if they're old, then we tailor it to them basically.
Yeah. Okay.
Yeah. So that's how it is for domestic animals anyway.
Okay. So let me put that through. So this is from a vet. And when an animal you take into your vet and gets castration, it has morphine, ketamine, whatever it is, or you heard it from the man itself, it's tailored to the animal. So the animal doesn't feel any pain.
That's the idea.
Yeah, okay. So for animals in our farms, which is standard practice here in England, so like for a pig, we get a scalpel, we cut their testicles, we pull their testicles out and we cut them off with no painkillers, no numbing agents, nothing. What pain would that animal go through?
So officially what they're meant to do is to inject local anaesthetic into the area, but you raise a fair point. There's a huge difference because that isn't in a nutshell kind of the anaesthetic protocol compared to what I described earlier.
Yeah.
So there's a big difference between what your dog will get and what your pig that you ate for dinner would have had basically when it was castrated. I think it's just there's a big difference between.
And so for an animal that's never had no painkillers, had their testicles pulled out of their body, how long after that procedure, after going through all that pain of having their testicles pulled out of their body and cut off, how long will their genitals be sore for after that?
It's not gonna recover the same day that you would do with your dog will go home and be comfortable. We would never send your dog home without pain relief, and they'd go home with oral medicines to have the next day, and they'll come back for checkups, and we'd check the wound, and there'd be someone at home to look at the wound every day and report any infections. And obviously then all that takes place with a farm animal. There isn't an owner, and I think that's the big difference. There's no one to give tailored care to that.
So on average, how many days do you think that animal will be suffering until it's healed where it won't have no pain in its genital area anymore?
I couldn't give you an exact answer. Most post-operative periods last about 10 days. That's
10 days! 10 days of being in that much pain. Now that's 10 days of someone having medication and they're okay. Wow, that's really full on. So what about for say sheep? So for sheep here in England, we castrate them with a very thick elastic band. So I went to an agricultural college. I refused to do this to the sheep because I didn't agree with it. And we had this, it was like this hook thing that went out that opened up the elastic band. Now the elastic band's about this thick and it opens up, and then we'd have to get the sheep's testicles and put the testicles in that, and then it would close on it. Now these poor lambs would wiggle around on the floor in immense pain. Like, how long would it take before their testicles have gone numb?
I've done it myself. It's mandatory as part of anybody that wants to be a vet. Anybody out there watching, you have to do all this firsthand. you know, I've seen it myself. You know, there's a big difference between what these guys experience and, you know, what my own dog would have experienced when she was neutered. You know, these guys, you know, it raises ethical questions, compromises you as a person, you know, when you end up doing it. Ideally, you know, these animals are meant to receive some kind of anesthetic or something to you know, take away at least the initial discomfort of what's going on. The reality is that doesn't always take place. It probably doesn't take place, and, you know, at the end of the day, these animals do suffer for a few days. I'm not going to lie, it's the way, it's the reality that of the industry is.
Suffer for days just to get the testicles fall off. I mean, so just hypothetically speaking, if I went home tonight, got some plastic bands, tied it around my dog's testicles, under the law of looking after a dog, what would I be facing if you had to do like a report for, say, the RSPCA or a report on cruelty? What would that report say if I had tied up my dog's testicles like that?
I think you're probably banned from owning animals. I think you need to be a vet to perform veterinary medicine or whatever it is, surgery. I think also the method is there's a big difference between the methods of what takes place in farm practice and what is done for your cat or your dog at home, basically. I'd say the standard of care, in my opinion, is obviously much higher. We have surgical gear and equipment, and I sterilise my hands and my gloves and everything. It's not feasible in the field, you know, if you're trying to neuter an animal in a big open field, or, you know, in a cage, dirty farm holdings, whatever it is. You're not afforded those luxuries, and there is a big difference, and that's part of the reason why I only look after cats and dogs. And, you know, this is the extent to which I have involvement with pigs, is kind of like turning up to pig vigils, you know, every now and then, shall we say.
Yeah, wow, so you've heard that from a vet yourself. So if I was to do those procedures like they do in farming practices on our dogs, I would be banned from owning a dog. Like, so the way we castrate these farm animals, if I was to castrate my animals the same way that farmers castrate their animals, I would be banned, and that's coming from a vet himself. Thank you for having this conversation.
No problem, my pleasure. You're welcome.
Do I have any more questions about this? No? Okay, cool. Thank you.
Ooh.
Cool.